Depending on which part of a survivor's body was penetrated and ejaculated, such as vagina, rectum, or oral, the appropriate sample should be collected. If the survivor is female, vaginal examination should be performed using a speculum and the sample should be collected. Please note that the survivor has the right not to allow this part of the examination. She should be explained what she will benefit from doing this examination, and it should be done with her consent. As she may contain ingredients that may destroy forensic samples. Collect discharge from the posterior fornix of the vagina with a swab stick. Then place a drop of the discharge on a slide and mix it with a drop of normal saline as needed, and place the slide under the microscope to examine the wet mount. Please record if there is any sperm movement. You should keep in mind that the chances of finding live sperm after 8 hours of intercourse are very low. The swab stick and the glass slide should be properly dried at room temperature, labeled, and stored for further examination. Another swab stick should be used to collect the sample from the posterior fornix, cervical os, or canal for DNA testing. The swab stick should be air dried properly at room temperature and stored. For acid phosphatase testing, a sample should be collected from the cervix or vagina separately. Similarly, another swab stick should be used to collect samples from the rectum for DNA and acid phosphatase tests. Samples collected for each case should be thoroughly dried at room temperature and sent to the laboratory for testing. Please keep in mind that sperm can be traced approximately up to 5 days in the posterior fornix and approximately 12 days in the cervical canal. If the survivor is not willing to be examined with a speculum, a sample from the vagina can be collected with a swab stick with her permission. All information should be carefully documented in the medical report and physical examination form after the collection of the specimen.